Hello and welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm real glad that you could join us for another segment. We're going to be speaking with Dr. April Batcheller. She's co-founder of CCRM Fertility Minneapolis and assistant professor at the University of Minnesota Medical School. She's joining us on the program to discuss the launch of Fertility House Calls. It's a virtual platform which her clinic is now participating in. It offers a simple way for those struggling on the path of parenthood to take the next step and visit their website. Welcome to Health Professional Radio. Dr. Batcheller, thank you for taking the time.
Thanks so much for having me, Neil. Excited to speak with you today.
Co-founder of CCRM Fertility Minneapolis and assistant professor at the University of Minnesota Medical School. Give us a bit of your professional background, if you would.
Sure, absolutely. So I was educated in Minnesota. My undergrad's from Concordia College University in Moorhead, Minnesota, and I went to medical school at the University of North Dakota. And then went to Beaumont Health Systems for my residency in OBGYN near to Detroit, Michigan, and loved my time there. Mm-hmm. And then subsequently went to the University of Cincinnati for my fellowship in reproductive endocrinology and infertility. And following that, did a short research internship with Dr. Schoolcraft at CCRM in Colorado. And then was happy to launch CCRM Minneapolis here closer to home. My goal was always to be able to practice amazing medicine and wanted to do that with Dr. Schoolcraft, but be a little closer to my family. So this really fit the bill.
How big a problem is infertility? How many couples are struggling with it?
You know, it's so common. 1 in 8 couples struggle with infertility. And I think now we're starting to see people more comfortable with the idea of sharing that with their friends and family, which I think is really healthy.
So what does a reproductive endocrinologist do?
Yeah, well, it's the coolest job, I think, because you really get to care for people that are trying to start their family on the medical front, at the same time be quite nerdy when it comes to understanding and manipulating the hormone loops that control the reproductive system, as well as really get to be involved in the cutting edge technology that happens in an in vitro fertilization lab where human embryos are created and can be genetically tested and transferred back to couples who otherwise wouldn't be able to be pregnant. So it's just such a neat combination of really great patient relationships and then classic medicine and technology all wrapped into one.
With so many people struggling with infertility, are reproductive endocrinologists easy to find?
You know, I wish there were more of us. It is a bit of a long path. You know, there's the undergrad medical school, residency, and fellowship. So there's only, I think, about 35 of us that graduate every year. So we really could use some more people going into the field. That's for sure. There is quite a demand on reproductive endocrinologist time, just given the frequency that folks are experiencing infertility.
Other than a lack of professionals in the field, what would you say are some of the other big barriers to accessing care for people who are dealing with infertility?
Well, because there's only, a handful of us around, one of the challenges is that most reproductive endocrinologists exist in major medical centers and in large cities. But infertility exists across the country, so it is harder for folks who are in rural areas and maybe not even so rural, but not in a major medical center to access the expertise of a reproductive endocrinologist. And
that, I'm assuming, is where Fertility House Calls comes in.
Fertility House Calls is such a neat platform. Basically, what it allows physicians and patients to do is engage and talk about their clinical circumstances without the patients actually having to take the trip into the fertility clinic for that initial consultation. So essentially what happens is that via a platform such as Zoom, for example, that we've all gotten really comfortable with during the pandemic, you can meet face-to-face with a reproductive endocrinologist without having to take half a day or a full day off of work to travel to a clinic just to sit and talk to somebody about your story. So I think it's incredibly helpful. And improving the accessibility of this subspecialty to people across the country.
How easy is it for qualified professionals to be listed in fertilityhousecalls.com and participate?
It's very easy. I think the main thing that a professional needs is to be a qualified, reproductive endocrinologist, and certainly the ability to participate in something like that is pretty simple. It's just a matter of embracing it.
Many times we hear about a doctor delivers a child, and often they know that child up until they're 20, 23, Is it the same for reproductive endocrinologists who help couples who have such a struggle having a child to form that bond with them for years?
That's such an interesting question. So most reproductive endocrinologists, really their focus is in helping people get pregnant and then transitioning them back to their OBGYN provider towards the end of the first trimester. And then their OBGYN provider takes them through the pregnancy and the delivery. That being said, it's really common for our patients to stay in touch with us and send us holiday cards and tell us how their families are growing. And we love staying connected to them in that way. Many times folks will have multiple embryos, for example, frozen, and will complete their whole family in one IVF cycle. And so you really do get to know that family well over the years, and they definitely stay in touch, which we love.
Now, talking about some of these rural areas, is fertilityhousecalls.com available nationwide? It is a website, and just because it's online doesn't mean that everyone has access.
Well, anyone with internet access has access.
Okay.
That's a great question. So really what fertilityhousecalls.com does is allows patients to log in and say, okay, where are some providers that are near to me that are participating in this telehealth platform, and then make an appointment virtually with that provider. So, having access to internet and technology is one of the main components of fertilityhousecalls.com.
So what type of feedback have you been receiving as a result of this platform?
Patients love it. It's really common for us to see patients that will schedule an appointment over their lunch hour. We can send a link to both them and their partner so that they can be present at the meeting at the same time, but while they're both in two different locations. And it really just made that initial touch point and having the conversation of how does this go and how can I, improve my chances of having a baby without having to have a whole rigmarole of taking time off of work. So we see people over their lunch, over their coffee break, before work early, ideally not during their commute if they're driving, but it really has just really reduced the amount of time patients need to take off of work and out of their own lives to start working on this project.
Now, fertilityhousecalls.com grew rather rapidly. I understand that it was initially launched in some of those major cities that you were talking about around the country in November of last year, but you're already available nationwide.
Yes, absolutely. And I really think that this, idea dovetailed with the pandemic, and this idea of telehealth is an acceptable way of connecting with your physician. The concept of, for a variety of reasons, maybe we don't want to go sit in a waiting room and hang out in the same airspace as a bunch of other people, has really opened people's minds and to the concept of being home and having a conversation, over an internet platform.
Well, is there anything else that you'd like to add before we ask for a website that we can access Fertility House Calls?
So I would just say that I'd really encourage anyone who's struggling with infertility to reach out to fertilityhousecalls.com and find a provider near to them that they can connect with. No, there's no reason to struggle in silence. Get the help that you need.
And that's Fertility House Calls, just like it sounds, all one word, .com.
That's right.
Well, I appreciate you joining us here on Health Professional Radio. It's been a pleasure speaking with you this evening. Thank you.
Thank you so much for your time. I really appreciate it, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. April Batcheller. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.